Hey, is that guy dead? Not yet. Should we, do something? Yeah, probably. The volunteers will be here soon. We should probably act like we know what's going on. Well, I'm going to start doing some crappy CPR, you do something paramedic-y. Right. I guess I'm going to give him some drugs. According to these charts and graphs and whatnot, I believe he's in VFib. You probably want to give him like a milligram of 1 to 10,000 epinephrine, right? That's the one that makes his heart go faster and makes his veins squish down so that his heart can pump crazy amounts of blood. Yeah, you could do that. If you were totally lame. All the cool kids use 40 units of vasopressin. Who told you that? Joe Mendoza. Oh Lord, I should have figured. So anyways, what comes next? How about some antidysrhythmics? Like lidocaine, it's cool because it chills your heart out, like numbs it by mellowing out your sodium channels. In a normal situation, I would agree to give him about 1 to 1.5 milligrams of Lido per kilogram of body weight, but I saw a piece of paper somewhere around here that says this guy might have hypersensitivity, a heart block, some supraventricular dysrhythmias, bradycardia with PVCs, and, God help him, Wolff-Parkinson-White syndrome. Wolff-Parkinson-White syndrome. Oh, you poor son of a. Yeah, it's a terrible shame. So anyway, let's give this guy like 150 milligrams of amiodarone. It works just as good, and it's crazy expensive. How about some cardizem? I've heard that's good stuff too. Yes, cardizem is great. When you have someone with an atrial problem, which we do not. So how about you keep your moronic suggestions to yourself, and let me figure this out. Just give him the amiodarone. Cool. Can we give it to people with second and third degree heart blocks? What, are you high? Don't be an idiot. What if I was high? What would you do about it? I'd wait until you stop breathing. When you were dead on the floor, I'd steal your wallet, and then I'd give you 2 milligrams of Narcan. Does it work on roofies? How about speedballs, whiz-bangers, sneaky petes, weeble waddles, wackadoos? No, it's an opiate antagonist. It competes for opioid receptor sites. So if you're overdosing on heroin or something like that, it takes away your high, and if you push it too fast makes you spray vomit like some kind of disgusting dragon. So, let's just say, theoretically, someone, like me, took 14 times the recommended dose of fentanyl, which is usually about 50 to 100 micrograms on the right over here. Would Narcan help me? Why would you take that much? Theoretically speaking? Yes, theoretically speaking. Why would you want to take that much of a drug that is used to treat pain by binding to opiate receptors? Theoretically, I had a headache. Well, I don't know if it would save you, but it would work against the fentanyl in your system. It would also work if you took too much morphine, which is also an opiate analgesic. Oh yeah, I forgot about the morphine. Well, how much is too much? The usual dose for people in severe pain is 2 to 10 milligrams. But you shouldn't give either of those to people that you suspect of head trauma with increased intracranial pressure. And I suspect that you are about to have some head trauma. I really think this guy is dead. Don't hurt yourself thinking too hard over there. He's not dead, his blood pressure is just really low. I'm going to set up a dopamine drip. How much does he weigh? A lot. Like 200 pounds. Maybe more. Poor fat loser. How much is that in metric? I don't know, something like 2,000 centiliters, or maybe 1 million kilometers. We'll say 100 kilograms. If he was hypovolemic, I would treat that first by pumping him full of fluids, but he's good. So I'll give him 2 micrograms per kilograms per minute. That's 200 micrograms. Where is that on the dopamine clock? I don't know. High noon? Oh Lord, you're worthless. It's right about 7 drops a minute. He's been down for a really long time. I bet you, he's getting pretty acidotic by now. Can you fix that? Heck yes I can. Hand me that sodium bicarbonate. The one in the yellowish brown box. Okie dokie. On second thought, hand me 2 of those. They come in 50 ml equivalent per loads, and I want to give him 1 ml equivalent per kilogram. Here you go, 2 sodium bicarbs. Just as ordered. This is 1 sodium bicarb and 1 D50. Pretty much the same thing, right? Both solve the problem, both come in yellowish brown boxes. Well, no, not at all actually. First of all, D50 comes in blue box, for Christ's sakes, are you colorblind and stupid? And secondly, D50 is used to treat hypoglycemia. If this guy was in ketoacidosis, we could give him 50 grams or so. Ketoacidosis, metabolic acidosis, blue box, yellow box, all the same thing. Oh my god, I hate you.
Would you two stop messing around? That guy was dead before we even called you. But there's a guy over here that really does need someone who can help him. You two will have to do.
Where the heck did you come from? Stop screaming at us. Yeah, calm down.
What are you talking about? I wasn't screaming.
She's hysterical. Hand me the midazolam. 5 milligrams should take her down a notch.
Wait, you can't give that to me.
Oh, I think I can.
No. I'm in shock.
Oh, right.
Just come with me.
Barf, ouch, barf.
This guy over here. He came in earlier complaining of stomach problems.
This is a hospital. Give him a $300 antacid tab and tell him to see his doctor.
We gave him 8 milligrams of Zofran, but that didn't fix anything. He's still all messed up. A few minutes ago he said something about taking poison.
Ouch, barf, ouch, barf, ouch, barf.
What kind of poison?
He wouldn't tell us.
Alright, I'll see what I can do. Don't barf on me.
Barf. Okay, I'll try not to.
What can I do?
Help me give him this activated charcoal.
What's that?
It's good, you will like it. You're not drunk, are you?
No.
Did you drink any acids or bases?
What?
Light bleach or drain cleaner?
Heck no, barf. Bloog.
Oh god, he passed out. I think he was lying about what he took. He probably took some kind of organophosphate poison. It's a shame that we can't trust crazy street people to tell the truth anymore.
I'm calling our lawyer.
I'm going to give him 5 milligrams of atropine, but we are going to need to get him to the ER.
Ouch, barfy, barf.
I hope he lives through this.
Me too.
Because we're going to sue him back to the Stone Age.
Okay, well I need to intubate him, so I'm gonna paralyze him with some succinylcholine. I'm guessing he weighs about 70 kilograms, so I think 70 milligrams should do.
He probably has torsade deep want.
That's ridiculous. Why would you think that?
It's a hunch, and I kinda just like saying it. Torsade deep want. See, it's fun.
I'm not giving him magnesium sulfate because of your stupid hunch. If he has a heart block, or is pregnant, it could be really bad.
What? Why would you say that? He's not pregnant.
Well, he doesn't have torsade deep want either.
All this excitement is stirring up my asthma. I need to find my adenosine inhaler.
I think you mean albuterol inhaler. Sheesh, what kind of doctor are you?
What did I say?
You said my adenosine inhaler.
What's wrong with it?
Adenosine is used to treat supraventricular tachycardias. You wouldn't want to inhale that. Especially with asthma. Although who knows, maybe a little asystole will do you some good.
I didn't understand one word of what you just said.
You're the most worthless assistant I've ever had, and trust me, there is some stiff competition for that title.
He looks dead.
Yeah, I need some help here.
He's dead. I'm gonna call it.
What?
What time is it? I'm calling it.
Well, mission accomplished, I guess. I hope we all can learn something from this. Especially you Shemeketa paramedic class.
Shemeketa rules.